Okay, let's talk more about the ribs. So all the ribs together joined posteriorly at the vertebral column. They're joined anteriorly at the sternum, which is this medial cartilaginous bony structure here, also known as your breastbone. This forms the rib cage. And if we look at this illustration, you can see that moving from the vertebral column around anteriorly towards the sternum, the ribs sort of slope down towards the sternum. They slope down from your vertebral column and then sort of curl up a bit and attach at the sternum. That downward position of the rib cage allows for the rib cage to be elevated for inspiration. So if you want to take a deep breath, you have muscles that are attached to the rib cage that pull up on the rib cage. And when you pull up on the rib cage, you're expanding the thorax, you're expanding the lungs, decreasing pressure within the lungs below atmospheric pressure, causing air to flow from outside of the body into the lungs for inspiration. Looking at the anatomy of a rib, and let me pencil in here real quick where the vertebrae would be, right? Where it would be attaching to the vertebrae. So there's sort of your vertebrae. And you could see that the rib attaches to the corpus of the thoracic vertebrae at a place we call the head of the rib. Just posterior, just behind the head of the rib, it is what's called the neck. If we keep moving along the rib, we get to a little indentation, a little dimple in the rib, also known as the articular tubercle, or more simply, just the tubercle. And that is the point at which the rib attaches to the transverse costal facet of the transverse process of the thoracic vertebrae. If we keep moving over, we get to a point where the rib suddenly takes a more dramatic curve forward and down. That's known as the angle of the rib. After the angle, the rib is going to course anteriorly towards the sternum, and that the rest of the rib is the body or the shaft. So head, neck, tubercle, angle, and body. We have three main categories of ribs, and they're categorized according to what they're connected to. So we have the true ribs, also known as the vertebral sternal ribs. And the word vertebral sternal tells you that these ribs run between the vertebrae, the vertebral column, and the sternum, right? Vertebral sternum. So these are the true ribs, the first 7 ribs. They all have a attachment posteriorly at the vertebral column, and all the true ribs have a direct attachment to the sternum. Now we have the vertebral chondral ribs, or the false ribs. Anytime you hear the word chondral, this word right here, that means cartilaginous. The false ribs, the vertebral chondral ribs, are called that because they don't attach directly to the sternum like ribs 1 through 7. 2, 3, 4, 5, 6, 7. Let me make sure I'm pointing to the right one. But they attach, if you see these 3 right here, they attach not to the sternum, but to the cartilaginous portion of the rib above them. The cartilaginous portion of rib number 7. So they're called vertebral chondral ribs. They run from the vertebral column to the chondral portion of the rib above it. And you also have your simply vertebral ribs, and they have no anterior attachment. They are attached only posteriorly at the vertebral column. Going back to the rib cage for a second. The rib cage is mobile. It can be moved up and down because the ribs have a gliding attachment with the vertebral column. So you're able to get some movement between the rib and the vertebrae, but also the cartilaginous portion of the ribs. So as the ribs get closer to the sternum, they get more cartilaginous. So you have this large cartilaginous portion of the rib cage anteriorly, and cartilage is bendy, right? And it's that bendiness that allows for the rib cage, that portion of the rib cage, to bend and torque for the expansion of the rib cage, for the expansion of the thorax and lungs for inspiration. And also the rib cage is important for providing protection to your lungs and your heart. This is what I just said here. I've already said that. So now getting to the sternum. So the sternum is this medial structure that our ribs attach to. It has 3 main portions: the manubrium on top, the corpus in the middle, and the xiphoid or ensiform below. I'll probably just use the word xiphoid. Getting into a little bit more detail with the sternum, if you take your finger and you touch right here, touch yourself right here at the base of your neck, you're going to feel that notch. That is the suprasternal notch right there. The point of articulation between the manubrium and the corpus is known as the manubrosternal angle. That would be right here. The facets where the clavicle, your collarbones, attached to the sternum is known as the clavicular facets. So if you can imagine, the clavicles would come down and attach here to the sternum. And so if you move your fingers sort of laterally, you're going to feel your collarbones, aka your clavicles, right there. The manubrium provides a point of attachment for the clavicles and for the first 2 ribs. When you move down the corpus, the body of the sternum provides attachment for 5 or more ribs. And then you have the falx ribs that are attached to the chondral, the chondral portion of the rib above it, and then you have the floating ribs that aren't attached to the sternum whatsoever. So, looking at the pelvis. So we've already covered the sacrum. That is this bone, this medial bone, and on either side you have your hip bones. If you take your fingers, your hands, and rest them on your hips, you are touching your ilium, that is your hip bone, and your hand is resting on the ilium at what is known as the iliac crest. Now getting into the pectoral girdle. The pectoral girdle is where your arm joins the rest of your body. Your arm is connected to the scapula. The scapula is connected to the clavicle, and the clavicle is connected to the sternum. That is the only skeletal attachment between your arm and the body. And that allows for this huge range of motion that we have. Problem being, if you break the clavicle, if you break your collarbone, your entire shoulder collapses in. And so here's a good image of what that looks like. It ain't pretty. So here we have our arm, the humerus, attached to the scapula. And you can see how the scapula is attached to the clavicle, and how the clavicle is attached to the sternum at the clavicular facet. Also pay attention to how the first rib sort of courses up and under the clavicle to attach to the manubrium.